I'll go ahead. So welcome, everyone. Thank you for joining us today. Welcome to our webinar, Our Most Challenging Clients, Fetal Alcohol Spectrum Disorders in Child Welfare, which is presented by the California Evidence-Based Clearinghouse for Child Welfare, commonly referred to as the CEBC. And my name is Jennifer Rolls-Roots, and I'm the CEBC Director. So before I introduce our presenter, I just want to review a few webinar logistics. First, the audio controls. Hopefully you've already got those. They are on the bottom left-hand side of your Zoom screen. We've muted all the attendees, but you can test your audio connection and make sure you've got the speakers or headphones that you want to use. If you have questions for the presenter or the CEBC during the webinar, please submit them using the chat box at the bottom of the screen. We will be addressing questions during the webinar, and I think that we're just going to kind of let you know when there's a question, Catherine, and jump in. So we'll try to fit those in. At the end of the webinar, you'll be directed to take a brief survey so that we can improve our webinars and make them as useful and relevant as possible. And also so that you can identify additional topics you'd like to hear more about. That's how we ended up with this one, is that we had people who actually requested something on fetal alcohol, and we said, great, let's find a speaker. Also, at the end of the survey, you'll be able to download a certificate of attendance. So if you're the kind of person who needs something for your work or just like to keep a record of what you've attended, you'll have that. Finally, the CEBC is funded by the California Department of Social Services, Office of Child Abuse Prevention, and we're operated by the Chadwick Center here at Rady Children's Hospital in San Diego. So now I'd like to introduce our presenter, Dr. Catherine Page. So along with a PhD from the Center for Psychological Studies in Berkeley and an internship at Stanford, a few highlights of her varied career include being a disability specialist for the Santa Clara County Juvenile Drug Treatment Court, a bilingual school psychologist in San Lorenzo, a 504 coordinator in the Santa Clara County Juvenile Hall, and a teacher of social workers with UC Davis Extension. She was privileged to develop a mental health program for Latino immigrants at Canal Alliance in San Rafael. And for 26 years, she has also written, consulted, and trained widely on fetal alcohol spectrum disorders in California and Mexico. But her favorite accomplishment has been the development and directorship of the Fetal Alcohol Spectrum Disorders Clinic at Valley Medical Center in San Jose. So thank you for joining us. I'm now going to turn the webinar over to Dr. Page.
Thank you so much. I am delighted to be here, and this is really an honor. And I do recognize some familiar names in the audience, and so hello to you. I do encourage comments and questions along the way, because this is a peculiar condition that we're talking about today, fetal alcohol. It's kind of hard to wrap your head around, and it's easier if you actually raise your confusions or arguments, of which there are some along the way. So, please go ahead and do that. What I leave out of my little bio is really one of the most personal parts of this for me, which is that I am the mom of a 40-year-old with almost for sure fetal alcohol damage. He came to me at the age of 2 months when I was living in South America in Colombia. At the age of 2 months, and when he was 16, I stumbled across fetal alcohol, and until then, nothing made sense because he had a high IQ, kept shooting himself in the foot, really always unhappy. I'm assuming that those doorbells are going to stop ringing sometime soon. Anyway, my son is really the reason. When I realized that fetal alcohol almost for sure explained his issues, at that point, my life just turned around to saving other people from going down the same road that we did, which included, lots of misunderstanding and anger and frustration and trouble with the law and school, etc. And clinicians who kept saying, well, take another parenting class. obviously it's your parenting. And since I'm trained as a psychologist, we're trained to believe that that's true, that it all comes from the relationship. We're not trained to look at wiring. So that's a lot why I'm here today talking about this. And you are here today. I actually would love to hear, if we had a ton more time, I would ask everybody to say what it is that drew you to want to know more about fetal alcohol. But that's an essay question. Instead, I'm going to ask you a sort of a raise hand question here of who has had training in fetal alcohol previously. So if you could just do your little, let's see, we can do hands raised here, right?
Yes, there's a reaction area in the
Yeah.
Zoom panel at the bottom.
Okay. It's funny, I usually work on Teams, and so I've kind of lost my chops here with Zoom, and I can't find are we in participants? Is that where we look for the hands?
Yeah, so right now we have about 7 people, 8 people with their hands up, thumbs up.
Oh, there's reactions.
Yeah.
I see. Okay. Oh, that's great. I'm glad that it's not everybody, because for those of you that have had some training, there will be some repeat here. I want to say that today we will be, oh boy. Okay, Jennifer, I need a little technical assistance. I'm hitting return to go to the next slide, and it's not working.
Okay.
I'm hitting escape, and it's not working.
Maybe if you just open the participant panel, do you want to try closing that? I'm not sure.
Yeah, I did. I did already.
Do you need to unshare and reshare and see if that starts it?
Let's see. All I got was new share. I didn't get the chance to unshare.
Okay, that's fine. Try a new share and see if that works.
Okay. It says I am. Oh, wait a minute. Let me stop share.
Yes, and then reshare and see if that works.
Okay. I think that's all it took.
Okay, great.
Yeah. I think that's all it took.
Nothing is share. Oh, here we go. There we go.
Okay, that's great.
Okay, perfect.
Yeah, I think something, let's see if I can. Okay, good. So why we're talking about this exactly, why we're talking about alcohol, prenatal alcohol exposure, and not really any of the others except in passing, was articulated by the Institute of Medicine way back when. Of all the substances of abuse, alcohol produces by far the most serious neurobehavioral effect in the fetus. Neurobehavioral meaning behaviors that come from the nervous system damage, mainly the captain of that ship, of course, which is the brain. It should have included methamphetamine and all other substances as well in this list, but alcohol is the one that does the damage. And how much of it is out there? We used to think it was 1%. That's decades old. Recently, we came up to 5%. Center for Disease Control is now using that. But the author of the study behind the CDC number, Phil May, the article in the Journal of the American Medical Association buried what he believes is the true prevalence in the middle of the article. because it just seemed kind of wild. And that result of that study was that 6.7% of US school children had fetal alcohol damage diagnosable, but it's still conservative because children in foster care were not allowed to be included in these studies. And the prevalence in foster care is roughly half the kids in foster care have fetal alcohol damage. So it's everywhere. It really is. And you're probably asking yourselves, why the heck are we not hearing about this, dealing with it, diagnosing it, getting services to support it, and working on prevention? If there's that much of it out there, she must just be making this up. It really is a little bit wild. But what happens is, since there is no real diagnosis to be found outside of 3 states in the Union, Washington, Minnesota, and Alaska, and Michigan's coming along too, Wisconsin, Minnesota, and Canada, people don't come to you, they don't come across your attention with a diagnosis. So what they come across with is difficult behavior, disobedience, trouble in school, but hard to pin down what the processing disorders are. So that's what we have, is at least half the kids in foster care, about 1/3 of people incarcerated, and nobody has actually come up with a statistic on homelessness, but it's way, way up there. And you will see how that happens as we walk through this. Okay, FAS is what most of us learned, fetal alcohol syndrome. We don't say that anymore unless we really mean people with the facial features that you'll see a picture of in a second. Most people with fetal alcohol spectrum disorder look totally normal, and they have IQs in the normal range, but the neurobehavioral challenges are, they range, but they are lifelong and they are serious. Los Angeles County also has the VIP clinic, which is doing really good diagnosis. Here we have the face. This is this adorable girl. You can't really tell that her eyes are small. That's because her head is small. But if you measured her eyes, you would see that they are small. Also, she has a thin upper lip, and she has a flat space between her nose and her upper lip. That's called the philtrum. Even when she's not smiling, she has a flat space. Many people, when they smile, they will look like the groove disappears. But if they're not smiling and it's flat, and they've got the thin upper lip, and they have the small eyes, that's fetal alcohol syndrome. You don't even need evidence of drinking to make that diagnosis, because this is the only way that you get these 3 features. There's a bunch of other features that go along with it too, but in less frequency. For example, ears that are lowered and rotated and smaller are sometimes seen with fetal alcohol, sometimes curved little fingers. But really, I don't spend time on this because most people with fetal alcohol damage look completely normal. This is a slippery condition. It is slippery to keep our heads wrapped around, and it keeps slipping off public awareness, professional awareness, all kinds of awareness, except for those of us that have adopted kids or foster kids or are in recovery or are raising our grandkids. And so living with it up close and personal, you go, whoa. When we had our clinic in Santa Clara County, we saw 90 kids before a new medical director, fresh out of medical school 20 years ago, said, I don't think it's a good idea to label children. So we only got to see 90 over the 1.5 years that we were in existence. And every time, pretty much, we'd sit around afterwards sharing the diagnostic conclusions with the caregiver, and tears running down the faces of finally somebody understands there is something wrong with my kid. It is not just that he's a boy. It is not just ADHD. It is not bad parenting, and it is not just trauma. So you are in a position to turn kids' lives around with shining this light of understanding on what is a difficult, puzzling, hard to grab a hold of condition. But before we're done today, you're going to have a kind of an informal screen burned into your brain. And hopefully the detective instinct to, to start sussing out if you're getting signs that this is it, to go further and ask more questions and put together the pieces of the puzzle. Of course, you will not be able to diagnose it, most of you. I think we've got a psychologist or two in the group, and you can diagnose it. I think we might have MD. In any case, you can, without diagnosing it, you can do this family the giant favor of saying, this is what it looks like. Here's what is fetal alcohol. Here's some material that I can share with you. Jennifer, did I send you the family resource list?
No, you did not.
Okay, I did not. I will, at the end, I will send it to you, and you can send it out if you don't mind.
Perfect. Yeah, we'll get that out to the group. We also had a question while I've got you about
Okay.
what was the name of the clinic in LA County that
Yeah.
you said was doing that great work?
Yeah, it's the VIP clinic. Stands for Violence Intervention Project, but just look up VIP clinic. They not only do diagnosis, they also do really great support for families. So they are terrific. All right, so what makes fetal alcohol so complicated and hard to hang on to? Well, it's not a cookie cutter presentation. It does range from severe impairment and actually beginning at non-viable fetus, because if you have, the heart gets laid down first, and if the heart gets laid down wrong, you're going to miscarry. And there's a lot more miscarriages with prenatal alcohol than not. But if you have the viable fetus, the severe end, you've got the low IQ, you've got dysregulation. The rages can be explosive and frequent, and real obvious disabilities. And these guys get support. Regional center will serve people with fetal alcohol as long as IQs are below 70, or somebody has given them the diagnosis of autism, which is not uncommon, or we advocate like crazy to get them into the 5th category. Also, what makes fetal alcohol so slippery is that within one person, there's a wide variation in ability. So it often breaks down that the person's verbal skills are really good and their practical skills are terrible. But you can have splinter skills, really great visual memory and terrible auditory memory, for example. So you've got people who have to hear things like, "You're so smart, I know you can do it," which is not helpful. Another is each person with fetal alcohol is different, right? You meet one, that's it. And this has to do, of course, with the timing of the exposure, the amount of the exposure, what the person brings to the party in terms of resources that they bring genetically, how well the liver is functioning. So each person is different, and that's part of your detective work. If you're sitting with a client and you're thinking, this is starting to look like fetal alcohol here, you are going to want to feel around through these various categories that we're going to go through to make yourself a little map. And, I want to say really, there's two outcomes that three, hoping for with you from this afternoon. One is, of course, that you get the lens of fetal alcohol that pops right on as soon as you're dealing with somebody that is just not responding in regular ways to your treatment or your parenting. You've got that lens of fetal alcohol that is ready right there for you to put on. Two, that the people that you're helping become self-advocates, so that at some point they know enough about their own functioning, and you will have a lot to do with this to help explain it. How does your brain work? And you'll have this sort of informal screen to reference. You got terrible memory, but boy, are you good with designing things. To really help the person, that's just a tiny slice, right? But to really help the person come to know what are the parts of their brain that they can't count on. So they know to self-advocate. For example, could you write that down? I'm pretty sure I'm not going to remember. I'm so sorry, I forgot to call you today. I do sometimes double, or whatever the thing is. Good apology is part of self-advocacy, so that's a big part. And then really the third hope that I have for you is that at least some of you, your heads are going to explode. You're going to recognize, oh yeah, I see this. I see it a lot. It's out there. It's in my client load. It's in my FFA. It's in my, it's out there. It's in my family. Okay. So anyway, moving down with what makes it so hard, there's also a change in functionality from day to day with sometimes no explanation. So kids in preschool will hear, Johnny, you knew your colors yesterday. I know, you just try a little harder, you will know them today. It is not true. It is not true. Little Johnny is trying as hard as he can. What else makes it so slippery is that there is this appearance of normalcy, a way of speaking that is perfectly normal, does not reflect the way of thinking or behaving, so that most of the resulting behaviors look deliberate on purpose, like bad parenting or like a mental health issue. Okay, so that's part of what makes FASD so slippery. I think another piece, I'm hoping somebody does a doctoral dissertation on exactly why is it so hard for our society to grasp fetal alcohol. But I think another one is that when you diagnose fetal alcohol, you're also diagnosing the mom. You're pointing a finger at the mom, which raises a whole nother issue that we won't really get into today about how do you talk to a mom about alcohol. I'll share with you a little bit, but it's a big subject. So the domains that are affected, these are where and this is what we're going to be talking about today: executive functioning, specific cognitive functions, how it affects relationships, emotions and communication, and sensory, motor, sensory integration. And what I've got in quotes here, the word morals. A friend of mine who adopted a lot of kids with fetal alcohol calls it moral retardation, but that's a very outdated phrase, so it got edited out. Now, one of the queens of fetal alcohol is Diane Malbin, who wrote a book called Trying Differently Rather Than Harder. And it is aimed at families raising these guys, who has, it's a 75-page book. It's been a lifesaver. And how she puts it is everything that we're going to see, everything that we talk about, is behavioral manifestations of a physical condition. Now, the physical condition is broadly speaking, brain damage, right? You have in the presence of alcohol, as the little brain is developing, you have brain cells that go astray and wind up causing all kinds of havoc. One of those pieces of havoc is, you see here on this slide, a nerve cell, and the long, one of the long tails are axons, and that's what connects the nerve cells. And in the presence of alcohol, the cover on those nerve cells is just like the coating on electrical wiring, only here it's called myelin sheath. It doesn't knit together completely. So you've got holes for those little electronic impulses to, to go off the rails, to not go in a straight line where they're supposed to go. So that's one of the kinds of damage. Here I will address the question that people often have. What about the dad? We used to think that the dad had nothing to do with this. And in fact, fetal alcohol only refers to the developing fetus in the physical presence of alcohol at that time. So the dad being a drinker isn't part of fetal alcohol spectrum disorder. However, new research is showing that dads that drink, thanks to mice who bravely gave their lives for our cause. Mama did not drink, daddy did. And the baby mice are showing a small effect, has not been replicated at all, I don't think, but one study anyway shows learning and behavior issues in the baby mice of dads that drank. Okay, so here's what we're going to be looking at today, starting with executive function, which is the core of what gets people with fetal alcohol into trouble. This is the direct link between mama drinking and baby winding up homeless later on, right? Okay, because you have, Jennifer, I'm going to just interrupt myself here and ask you to be sure to remind me of those 4 great questions, because I don't have them right in front of me and I'm not sure where they fit as I think through my slides. And so when it seems like I'm taking a breath or casting about for what to say next, if you would just interject those, I'd be most grateful.
Sure, will do.
Right. Thank you much. Okay, so executive function. I actually am going to ask you to imagine a big picture like 6x4 on the wall in front of you with an ocean, lovely blue sky and blue ocean, big steamship heading right for a little sailboat. Now, imagine that you are standing within a couple inches of that picture. You're standing right in front of the sailboat, and I ask you, what is that picture about? And you say, it's about a sailboat. But you move over, and now you're standing in front of where the steamship is, and I say, what's the picture about? And you say, oh, it's about a big boat, ship. You are not getting the big picture, because the steamship is headed right toward the sailboat, and disaster will ensue if something doesn't change. Executive functioning is all of those types of thinking, all those parts of the brain connecting to each other effectively to enable a person to make good decisions, to help them understand what's going on, to help them remember what worked last time, to understand cause and effect, to know what has to happen in order for that big ship to not, kill the little ship boat. So with fetal alcohol spectrum disorders, even people with IQs well above average, which does happen, rarely, but it happens. Most everybody is right in the middle. Let me start that sentence over. Most everybody is slightly below dead center average with IQ, but well within the normal range. it does spread out to some people with higher IQ and some with lower. All right. So you got high IQ people doing dopey things all the time. It is, having fetal alcohol is a little bit like being drunk, right? Because the frontal lobe, as when you are drinking, it's the first to go dark. And with fetal alcohol, the frontal lobe is disconnected, goes dark. So the ability to use good judgment is out the window. But just keep in mind this being inebriated thing, because it too is on a spectrum. So judgment of like, sure, give me the keys, I can drive, or this is my new best friend and I'm going to give him everything I've got. We have gullibility here, tremendous gullibility. Impulse control, no ability to connect cause and effect. If I like your pen over there and I'm, pretty affected by fetal alcohol, I might just take your pen, in a moment when you aren't looking, maybe if I'm smart about it, without thinking of how it might affect you or what might happen if I get caught. Cause and effect is the thing that most disrupts regular parenting attempts. As you know, behavior modification relies on cause and effect, on if you do the right thing, you get rewards. If you do the wrong thing, you get stuff taken away, right? So this is the thing that caregivers just do their best with those sticky charts, and it doesn't work. So if you can transmit that to the caregivers that you're helping out with these kids, hallelujah. Okay. Poor organizational skills, lack of future orientation, can't really make real what's going to happen tomorrow or the next day. Some of you are working with families that really do want to keep their families together, and they will say, yes, here's what I know I need to do to keep from losing my kids, but then they don't do it if the parents are themselves fetal alcohol affected, which happens. You don't outgrow it. You would do that person a giant favor if you start to pick up some of these features. You would do that person such a favor to just raise the question. For example, I'm just curious to know, when you were little, was there alcohol in your household? Was it everybody? Mom, dad, everybody? Yeah. You have right there. Yeah, no, it's not hard documentation of prenatal alcohol exposure that would stand up in court. But because the mom didn't find out she was pregnant until, later, because nobody does, hardly, you have a beginning sense of, yes, there was fetal alcohol exposure, and yes, we have some of the signs. Let's see. I would like to share the grid. Jennifer, you have the fetal alcohol symptoms of fetal alcohol damage grid, right?
Yes, I do. I can go ahead and let me see if I can pull that up.
If you could just pull it up so everybody knows what we're talking about, and then we take it back away again. But this is a handout that everybody can access later on, right?
Yes, it is on the website, and we'll be sending
Okay.
everyone a link to it afterwards as well. Okay,
Oh,
I'll go ahead and share. You'll have to
Okay.
reshare your screen after in a sec.
Okay, that's fine.
Okay, it should be seeing the grid now.
There we go. And can we see the whole thing?
Let's see if I can. Is that better?
Oh, that's good.
Good.
For people that don't have bad eyesight, or that are using very strong glasses like me. Okay, this is something that you can print out, have handy when you are trying to remind yourself of what are all these little pieces that Kathy talked about that are part of fetal alcohol neurobehavioral impairment. This is old. It hasn't been organized exactly the same as the talk today, but it's got all the same stuff in it. And so I'm just going to walk you through it quickly, and then we're going to go back to our regularly scheduled program here. You got your ADHD type symptoms, the hyperactivity, the disorganization, distractibility, and impulse control problems, the sensory motor that we will get to, lots of aspects of executive functioning. We're going to get to speech in a minute. And I should edit out the retardation part, but you get the point here. And then how this affects emotions. And the last little, what do you call it here, row, is possibly the most helpful to keep in mind as you're dealing with somebody that's really frustrating or puzzling to you. There is a youngness. People will say different things. Some people who teach this stuff will say, well, they're half their chronological age really in functioning. Some people will say they're a third. It's impossible to say. Everybody's different. But there's no, I have not met a single person with fetal alcohol who isn't operating considerably younger. My son, when he was 18, very high IQ, couldn't succeed at anything. We all thought it was on purpose. We measured adaptive behavior, which I hope, I am hoping that, those of you that are doing assessment or recommending assessment or advocating for assessment, you will ask for adaptive behavior to be measured. It's a questionnaire. It's the adaptive behavior scale, Vineland. Embedded in that is, in the results, is age equivalent. So here's my son, 18 years old, high IQ. Everybody's mad at him because it looks like he's just not trying. And he comes up with, he's functioning at age 7, 8, and 9. And all of a sudden, the lights went on. We all recognized the truth of that. So if you can keep this one in mind, this is where you take all of these features, the executive functioning, the, everything, you throw it all into the hopper, you wind up with a younger functioning person. So if you can, I think some of you are probably right now thinking in terms of one person or two, or somebody that's starting to sound kind of familiar here. If you could also add on, how do I really think that person is functioning? At what age do I think that person is functioning? I bet you'll be able to come up with a number. And if you can keep that in mind, it will keep frustration down, which is a huge part of the interventions, is just making sure that everybody's regulatory climate is as calm as possible. Okay, thanks so much, Jennifer. Now I'll go back. Let's see, do I want to continue? Start
Yes,
share.
go ahead and start share again.
Okay, there we go. Now, oh God, back to meeting. Jennifer, do I have to go back to the meeting?
No, you're in it, but
I
you don't have your slides up, so you just need to share your slides.
Well, I tried.
Hmm.
Okay, sorry, it's just gonna take me a second to retrieve that. Oh no, there we go. Never mind. Okay, are you seeing executive functioning impairment?
Yes, now we are.
Oh, good. Okay, great. So I spent all the bulk of the time in talking about these specific slices of functioning on executive functioning, because that is really where the rubber meets the road. in terms of intervention. I see that we have 14 items in chat. Is there something new coming up there I should pay attention to?
No, you're all set. Just question
Okay.
for us back in the run.
Okay, great. So cognitively, there's just a couple points that I want to highlight here. One, because I've already said a bunch of this. The learning problems are really, they really boil down to 2 or 3. One is memory in general, but particularly auditory memory, that what comes through the ears is, it does not arrive into the brain in any, well, on a spectrum, usefully. Also, the body is so kind of uncomfortable and hyperactive and reacting to the environment, that information has a hard time getting in. And then the last one is that there is a slowness that is very common with fetal alcohol. And we're going to get to that when we get to communication in a second, but keeping in mind that the person might just be walking their way through as the brain is slowly organizing information that it should be. That will help everybody's patience. Again, a key in intervention. How this affects relationships, we have, and this is going to look like autism, and I'll explain that also in a minute. Poor ability to read social cues, what looks like a lack of empathy, although I must say it's not an intuitive lack of empathy. I mean, no, it is an intuitive lack of empathy, but it's not that most people with fetal alcohol just don't care. It's that it's disconnected. And so if you can walk them back to, you know, Johnny's feelings were hurt when you took his truck. You probably don't want that, and you can make it better. They'll be, oh, okay, yeah, good. I do want to make it better. But it just didn't, it didn't immediately make sense. There's a lot of fetal alcohol that is amenable to bridging over. So if something isn't working right, you can help with little explanations, with visual input. You can help bringing an attitude of patient, humorous curiosity, because what you're ideally doing, those of you who are working with people with fetal alcohol, and anybody in a clinical sense is you're linking arms really with the true self against a glitchy brain. The true self wants to belong, wants to do good, wants to have fun, does not want to be always getting in trouble. So you are linking arms with that true person, and you're together looking at, oh, I know that you did not want for Johnny to feel bad, and we can fix it. And that true self is, unless they're really damaged in other ways, with attachment, with trauma, really damaged, that kind of bridging is going to work. And you'll see in a couple other of these categories where it's even simpler rather than just relationships. There's also, let me skip down here to inflexible, rigid, perseverative thinking, my way or the highway. Tell you about a little piece of research I love. It's old. It involves, again, our little mousy brothers and sisters, exposed to alcohol, not exposed to alcohol, given a maze with cheese at the other end, and the non-exposed mice, they know the cheese is over here in the corner, so they head that direction. They bump their little pointy heads on the wall and they go, okay, there must be a different way to do this. And they find the cheese. Our alcohol impacted mouse bumps his pointy little head, but goes, hey, what's that wall doing there? That wall is not supposed to be there. I know that's where the cheese is. and I am gonna get to it. And so they just keep going. They keep banging their head against that wall. I know you know people like this. Okay, difficulty understanding consequences. So, you know, completely baffled about why friendships fall apart. These are kids when they're little who are very social, really want to be friends, certainly want to be invited to birthday parties, starting not to be invited to birthday parties because of these interferences with relationships. Now, any way that you can help teach, go for it. Simple teaching. A lot of our work as psychologist types is interpretation, theorizing, understanding. With fetal alcohol, if you can come in closer and name the difficulty, it looks, you know, to say something like, you know, it looks like it looks like you didn't get invited to Johnny's birthday party. I bet that feels bad, doesn't it? You know, there may be some things that we can do, practice, to make it easier for you to make friends. And then you know, start to do that. But to name it with that kind of sympathy is probably the first time the person has heard one of their neurological glitches be named with anything but shame or blame. Right? Like, what is wrong with you? You just, I mean, you know how it sounds. So you can be the first person to turn that around. Now, how this shows up in emotions, there's just a couple of high points here that let me say them for you. One is that there's a kind of disconnect between awareness and feelings. Our feelings happen in the body. With fetal alcohol, there's a disconnect, so that up in the head, there can be lots of language around feelings. There can be lots of apparent understanding, but in fact, that disconnect makes it hard to recognize or feel the feelings in yourself and certainly in others. Little ability to articulate. So you may have been with clients who you say, well, what does that feel like? And they say, I don't know. Or they answer something completely different, or they just don't answer. There is a real difficulty recognizing and articulating feelings. So that's one big point. The other big point has to do with this sense of urgency and intensity that lives inside this nervous system, causing in little kids frequent meltdowns over small things. Well, adults too, they just don't look like throwing themselves on, you know, the floor of the supermarket. But melting down over little things. So we have, as adults, we've got crisis to crisis type living because they're always melting down over something. Also because planning is so difficult. So making sure there's gas in the car is, you know, sometimes doesn't happen. So you got crisis to crisis. We have an anxiety along with that sense of urgency and intensity. And here is another little piece of research that is recent, that is, it shows the kind of the beginnings of this at newborn. We're always trying to find ways to diagnose fetal alcohol without waiting until the age of 3, which is what most of us have to do, because all of these executive functioning and cognitive skills and capacities don't settle in until about the age of 3. So you can't test for them. But we're always looking for ways to see. So some enterprising researchers put electrodes on newborns, some alcohol exposed and some not, and measured the heart rate when a bell was rung near them or a light flashed. And the ones who were exposed to alcohol had a more intense reaction. It took a longer time to calm down and many more repetitions before the nervous system said, okay, not a big deal, we're fine. So here we see the very beginning of what later on and all through the life is going to look like, overreaction, right? Meltdowns, tantrums, and anxiety, and a sense of urgency and intensity. We have to get there. We have to get there. We have to get there now, right? Because there's just that ongoing chronic sense of the heart rate is going up in what is a perceived emergency. Okay, so that is really important to keep in mind as you're working with somebody.
Dr. Page, I'm just going to jump in. We had a question about how much exposure needs to happen to the developing fetus to show
Great.
these types of symptoms.
That's
And
great.
also just to let you know, we're almost at the top of the hour.
Yes.
So we can go over, but just to let you know, we're almost at 60 minutes.
Okay, but we are going till 2:30, right?
It was originally scheduled just till 2.
Aye.
We will keep going. We're not going to cut off, but if people have to leave, we'll have the recording available. If people can stay, great.
Oh my God, I had written down 90 minutes, 1 to 2:30. Yeah. Wishful thinking, huh? Okay.
We will keep going. The Zoom line is open. Go ahead and keep delivering as you intended.
That's great. And anybody that has to leave can access these slides later on. I am happy to say. Okay, so speech and language, there's a couple quirks having to do with fetal alcohol. The main one is that expressive language is intact, receptive language is impaired. That means you're a better talker than a listener. It means that you sound good. But in back and forth conversation, you find person is not paying attention really, answering things that you didn't say, dominating the conversation, just talk. Okay, bottom bullet here, slow processing speed. This is very important to convey to caregivers. It's been a lifesaver for some of our families. If you're asking something or saying something, you don't get a response, just wait. Be patient, give it 10 seconds. Diane Melvin says, these kids, they're 10-second kids in a 1-second world. Try to give it 10 seconds of silence. Oftentimes that person will come back around with a real response. Sensory motor, we have clumsiness. Handwriting is often labored. Auditory processing, which I mentioned before, is off. And proprioceptive, where you don't know where your body is in space. Often we see, the signs of spills on the shirt, food spills, because the little spoon did not know exactly where the mouth was. So we have drips. Sensory integration is one of the ones where you can be very, very helpful. And also this can really cement rapport. As if the person is, for example, playing with the back of their neck, you say, do the tags on the back of your shirt bug you? Oftentimes the answer is yes. We have tactile sensitivity. This is very much like the sensory integration you see in autism. It's the same. It does account for a lot of the meltdowns with both little kids and adults, not knowing that their agitation comes from sensory impingement, from lights, sounds, smells, tastes, touch. So if you can say, oh yeah, that you've got sort of like a little bit raw nerves, and that is so distracting. It really bugs a lot of us. And you can make suggestions. Target has T-shirts with that they just stamp the tags in the back. For example, if you can help to name it, strategize. Again, it might be the first time that somebody has named a wiring glitch, not in a punitive way. Other people are going, could you just stop fussing Can you hold still? Just quit playing with your shirt, you know? Take your sunglasses off, but in fact, the sunglasses might be on because the lights are too bright and they're bugging these people. Okay, so this is one way that you can really let the person know you are in their corner, and help them strategize some ways to be more comfortable. Now I have moral in quotes here, and I only have
Dr.
lying
Page,
down.
I'm just going to stop
Yes,
very quickly, just to let
yeah.
you know, it's pretty clear from attendees, let me know that the invitation they got was for 90 minutes.
Oh,
My apologies. For some reason, Zoom gave me a 10-minute warning, but we're good to go. So
excellent.
attendees, we're expecting 90 minutes, so we are set. Don't want you to rush unnecessarily. All
Oh,
right, thank you.
hallelujah, hallelujah. Okay, so right after moral, I want to take the 4 questions, okay? The 4 questions that
Yep,
you
I
have.
can do that. Perfect.
Okay, good. Okay. So moral is in quotes here. And it's the thing, God, I don't even know how to characterize it. It's the thing, it's the behavioral manifestations of brain damage that winds up making these folks look bad, get incarcerated, get kicked out of school, lose relationships. And the thing that's the clearest, well, there's really lying, stealing, and cheating. Lying and stealing are very clearly based in brain issue. We think that the corpus callosum, which is that thing, I'm sort of illustrating here. Can you guys see me at all? Or can you just see the screen?
Most can see you. It depends how they have their screen set up, but your picture is
Okay.
there.
Okay, so as I'm going like this, I'm showing you where the corpus callosum is in the head. It's that structure in the middle of the head that lets the left side, or language, talk to the right side, which is, and this is way simplified, right? Action. A lot of us in this field think that the problem with truth that we often see with fetal alcohol is a direct result of the corpus callosum taking a hit. It takes one of the biggest hits in prenatal alcohol exposure. So we have language over here going off on its merry way without much communication with like what actually happened or what a person's actually thinking, or any piece of truth. So we wind up with what looks like lying. We call it in this field confabulation, because that's what in the Alzheimer's field or traumatic brain injury is called confabulation, which is a less horrible word for what happens, right? And it is often, it's just that disconnect. In the moment, something seems absolutely true to the person and they will say it. And very often it is unsuccessful because the evidence is everywhere. Did you take those cookies? No, I did not. Well, there is a trail of cookie crumbs from the cookie jar to your mouth. Oh, no, there isn't. But there it is. It is, we call it crazy lying in the fetal alcohol field because it is very common, adults and kids. Okay, the person is often unaware at the moment that that's what's happening, is that they're telling something untrue. It is partly a function of memory, that they do not remember what actually happened, what they were going to do, etc. So that's the lying part. For stealing, it is a matter of there's a phrase that's often used with fetal alcohol: innocent delinquency. It's not premeditated, it's not mean, it's not meant to hurt, and it's with zero appreciation of consequences. I remember this happened all the time to me with my son. Well, he took my grandmother's engagement ring and gave it to his girlfriend of a week, and did not understand why I was upset. And there was another one where I come home and I find my phone charger cut. The wire was cut. So I ask him, what's the deal? He says, well, I needed some speaker wire. totally innocent. So there you have some of the moral, what looks like character issues, what looks like morals, and is in fact based in this disconnect in the brain. So what a lot of families wind up doing with the stealing part at home is they just lock everything away. I mean, there are some desperate, desperate families out there raising kids with fetal alcohol. And if they had known early on that fetal alcohol was present, that there was alcohol exposure and they were starting to see some signs, and they had had some help shaping, shaping behavior, shaping the environment, shaping communication, moving towards self-advocacy and self-understanding, a lot of this could have been avoided. So if you're feeling like I'm putting pressure on you, you're right. I am. So here we go to where there is trauma and FASD, which of course in the child welfare system, there pretty much always is to different degrees, but there is. The symptoms, many of the symptoms do mimic each other. You'll see in this lovely graphic, but let me save that for a second. Just had to make sure it was there. One of the big differences is that with trauma, all of the symptoms come from the fear of the stuff that happened and defending against feeling it now. With fetal alcohol, we have fearlessness, we have gullibility, we have way too much trust. So that's a big dividing line between the two. Your trauma treatment, some of you are in the business of mental health, I think. And so you're doing CPP, CBD, you probably know all the alphabet soup. Your treatment needs to be modified to adapt to these functioning gaps of fetal alcohol. And on the last slide or two, I'm going to summarize for you again. I do want to make sure that we get to those questions that I think I must not have taken a breath. Otherwise, Jennifer would have jumped in and said, hey, wait a minute, you got those questions to go before you do trauma. So let's do it after trauma. Okay, so we will summarize in a little bit what those adaptations would look like to normal treatment. Calming is extra hard with these guys. Remember the cardiac orienting response with the little guys and the electrodes? It's extra hard and it's extra important. Fetal alcohol symptoms don't go away. The trauma symptoms will go away if there isn't fetal alcohol, or if the fetal alcohol is, really pretty minor. The trauma symptoms will abate with your good care and everybody working together. Fetal alcohol symptoms can be managed, but they will not go away. We can't put brain cells back. We are not going to improve the memory whatsoever, or the sensory issues. It's all going to be there. What we can do for fetal alcohol is, I think I'm repeating myself here, but this bears repeating, so here I go, is to, as much as possible, eliminate or reduce the sources of stress. And some of those are environmental, incoming environmental stimuli, the noise, the lights, the tags on the back of the shirts, the you talking too long and too much, right? We have to simplify, put routine in place, try not to deviate, put structure, take away a lot of that free time and free decision, because that's a recipe for disaster with our guys who cannot think ahead, who are gullible, who desperately want to belong, right? Okay. So here we have this great graphic done by Canada. which I'm not going to walk through word for word, but I wanted you to have it so that you could look at it at your leisure. And when you are talking to somebody else about fetal alcohol, which I bet you will, you can have this ready to hand out or send along. And these things in the middle, of course, are where they do overlap. Let me just say, this seems a little random here, but let me just say, in this overlap part, the third to last is difficulty sleeping. For our guys, if you can get that sleep disorder nailed, many people with fetal alcohol have sleep disorders. If you can get it nailed, get it, if you need to, get it medicated, go to a doctor. Let me share with you a little image that Ira Chasnoff uses. Ira Chasnoff, some of you know, is a pediatrician that's been doing this work for a long, long time. And he says it like this, that we all boil over when there's too much stress. It's like a tea kettle on the stove. You turn that heat on and eventually it's going to whistle, it's going to rattle, it's going to shake, it's going to boil over. We all do that. A person with fetal alcohol, now remember that cardiac orienting thing with the electrodes, right? He's talking about the same thing. People with fetal alcohol, their little tea kettle is always on simmer, a lot closer to boiling over. So anything that you can do to keep the body or the environment or the interaction calmer is a big favor. And so sleep is huge. You know, when you don't get enough sleep, you're not functioning at your best. You're a little snappish, perhaps, and you're not thinking too clearly. People with fetal alcohol, worse, way worse, and they start off a little worse. Okay. The secondary disabilities. This
Do
is.
you want me to jump in with those questions now?
Yes, thank you. Yes, right now.
Okay, I'll drop them in the chat and I'll also read them out loud so that everyone can see.
Okay.
So one of the first questions we had was, do people with FASD qualify for Social Security benefits or APD services? I know it's a spectrum, so how do they determine eligibility?
What is APD?
I do not know. So if anyone actually submitted this question, go ahead and put that in there, but we can probably talk about Social Security in the meantime.
Yes. It's kind of like getting somebody with fetal alcohol into regional center. It takes a lot of pushing and shoving and dedicated advocacy, because they're going to look at these are people who can get jobs by and large, except for the people at the pretty low end of functioning. Remember being drunk? Remember how charming a lot of drunk people are, or even alcoholics tend to have a certain charm. People with fetal alcohol tend to have a kind of charm. And so they do get jobs. They lose them like clockwork because they're taking things too personally. They can't manage time. They get confused easily. They can't follow directions. They think they know better than the boss. They'll flip off a customer. But the Social Security person says, well, they can get a job. I see here that they worked before. So if you can get that, I'm going to type the name of the adaptive behavior thing. How do I get to everyone? Everyone, here we go. If you can access one of these, Vineland Adaptive Behavior Scale, that's the one that will give you the age equivalent and tell you how they're doing adaptively, which is usually really low. With fetal alcohol, normally you've got IQ up here somewhere and school performance down below that, and then well below that adaptive behavior. That's going to get you into Social Security. Okay, so it's key to getting understanding of various kinds. All righty, Jennifer, what do we have next?
All right, our next one is what is the difference between a neuropsychological eval and a neurobehavioral eval for FASD children?
Okay, I have never heard of a neurobehavioral eval. So I don't think I can answer that one very well. And I was trained as a psychologist, so maybe it's something new. There are screens and checklists that call themselves neurobehavioral, but a neuropsych eval is one that tests neurological functioning across the board, neurobehavioral functioning across the board, language, memory, reasoning, all kinds of things. And so neurobehavioral, I'm really not sure. Sorry about that.
No worries. Let me put up the next one.
Okay.
So someone who is looking for best practices in recognizing and assessing for fetal alcohol spectrum disorders and how to build case planning supports and skills to help parents.
Well, there you go with the gazillion-dollar question. Thank you for that. Let me direct you to page in the DSM-5, right? Do a lot of you have access to that? I'm hoping.
I did post the excerpt in the resources area. So if you're
Okay,
talking
good.
about the pages about fetal alcohol, they
Good.
have that on the resources page.
Okay, that is great. That will tell you. That tells you it is a beautiful schema for diagnosis. It's the one that is only in place in some advanced thinking areas now. In fact, the guy that wrote the American Academy of Pediatrics toolkit on fetal alcohol spectrum disorders has revised his thinking and is now recommending exactly that. It is much simplified. I'm just going to summarize it for you in a minute. You got 3 areas that you're looking for impairment. 1, adaptive behavior, right? You've got the Vineland right there. Adaptive behavior. 2, regulatory issues, the ability to control your reactions. So if you're having meltdowns all the time, or if you can't control your focus and attention, so you have ADHD, that's segment number 2. Number 3, neurocognitive impairment, where and that's where executive functioning comes in. Also, if you have a lowered IQ, or your memory and executive functioning, if you kind of are not able to think clearly, but it spells it out in much greater detail there in the section that Jennifer put up for you. That is a beautiful assessment and about putting together a plan. That is, let's see, how do I do this in 30 seconds or less? Let's hold that for a minute because we're gonna come close to it, and then I'll try to leave a couple of minutes to expand at the very end. All right. Okay, is there another one?
We've got one more, and it is about recognizing, treating, and supporting families whose children may have FAS with attachment-based therapy.
Yeah. Okay, we're not saying FAS anymore. We're saying FASD, unless you really mean the ones that have the facial features. Sorry about the nag. You can count on me for that. Attachment therapy. If the caregiver is well educated and supported and resourced around fetal alcohol, and particularly how it shows up in their kid, then the attachment therapy will work better. Okay? Because if the caregiver is not, then they're going to keep making wrong attributions about the behavior of their child. They're going to keep reacting with anger, frustration, disappointment. They're going to keep trying to shape behavior at home in ways that rely on consequences. So that's the caveat.
We had one more question come into the chat box, so I'll read that.
Good.
FASD behavior in adults can be perceived as far from innocent and may even include aggressive defense mechanisms.
Oh,
Also, by adulthood, many other diagnoses have likely been assigned, leading to refusal to accept this new diagnosis.
You
Do you
bet.
have any standard recommendations for long-term management in adults?
Wow. Oh man, what genius was it that asked that question? I am serious. That is a very, very good question. Who was that?
Latrentis Smith. I think I have that name right, hopefully.
Well, that is, I'm just scanning my brain here to see if there's a way that I can actually answer it in this time frame. You know, actually, the multiple diagnoses start accumulating about the age of 6 or 7. And it is a clue that you've got somebody with fetal alcohol if you've got ADHD, learning disabilities, depression, bipolar, even schizoaffective and borderline. If you've got some collection of all of that, chances are very good that you have fetal alcohol. And you are right that there's a lot of refusal across the board, but to accept another diagnosis. But if you can make the point that I haven't even made yet, and I hope to very soon, that prenatal alcohol quite likely has caused these various clusters of symptoms. And so it's kind of an explanatory basket, really, that holds all of these troubling things. That might be helpful. The other helpful thing, I have seen so much relief come to adults and kids when we say, this failure, that reaction, that busted relationship, that, they are not your fault. I know we say that around trauma, we say it around a lot of things. But if we can name these things, these are things that people feel a great deal of shame about and failure. And if we can just on a lovely, warm silver platter lay out, these things are a matter of wiring. You don't have to call it fetal alcohol if it really doesn't seem in your clinical judgment like it will be helpful, then don't. Call it wiring. And that'll do it. What we're trying to do is to take off the onus of that this is bad behavior and you should control it. Okay, so thank you so much for those questions. I'm going to go back to secondary disabilities, if that's all right, Jennifer.
Sounds good.
Okie doke. This is what happens when fetal alcohol is not identified or adequately treated. Sometimes it's what happens even if it is. But identification is the single most effective intervention because it changes everybody's expectations. Remember, if you just remember one thing, remember much younger. Okay, so maybe you have somebody that's 18 with a bunch of diagnoses, but they're actually 9. That is going to give you a window into more realistic expectations and reactions. Okay, so we have all of these things that happen, all the things that cause lives to go wrong or that are signs of life going wrong. Mental health issues are starting to shift category here from secondary to primary, so that fetal alcohol also messes with the neurotransmitters in utero. So serotonin, dopamine, oxytocin, etc., are not generated right with the fetal alcohol person. Remember that cardiac orienting response. Their little neurotransmitters did not help them learn to roll with the punches. And that keeps going. Now, dependent living, this is from 1995, this study, big study. This would have been homelessness or couch surfing, excuse me, or woman under the thumb of a controlling man, or somebody under the controlling thumb of another person, actually. Oh, great, it's not letting me return, and it's not letting me escape. Okay, I'm so sorry, I have to do this again. Stop share. Share screen. Okay. Okie dokie, fixed. Okay, we just did that. You might have already gotten a sense of this, that there is, from the inside, constant hyperarousal interspersed with exhaustion or shutdown, ongoing sense of dread. What am I going to screw up next?
We are not seeing your screen. If you can try that again.
Oh,
Share screen.
no. Okay. How about now? Participants can now see your screen, it says. Is it true?
Yes, correct. You can see it. Thank
Okay.
you.
Okay, good. There's little actual fun. Research shows people, thank you, mice, people come in with up to a third fewer dopamine receptors thanks to prenatal alcohol exposure in utero. That means that their capacity to have fun is truncated. Others are often angry or disappointed. Now we get to FASD is almost always misdiagnosed as ADHD, central cluster of symptoms, ADHD. Autism, very often a close second. With that distinction of fetal alcohol, people want to have friends, autism, not so much. Bipolar disorder, we have the neurotransmitters swinging a person around from pillar to post. Borderline, attachment disorder, and of course we have ODD, who would not be oppositional with everybody misunderstanding them, and PTSD. Now, here are a few principles of intervention. Family, oops, let me go back. The caregivers are key. I'm going to send you that list of resources, which has some great short videos, a couple of excellent books, some articles, some online support groups. The help is not coming from professionals by and large yet. It's coming from peers, except for you. You're the professionals that will be helpful. Remember sensory issues and the environment. Keep it simple, simple. Communication, keep your sentences short. Don't, even if you're a word lover like me, keep them simple. Keep your communication simple. Don't keep talking. Remember that the memory is toast. And so be patient. Know that you will need a lot of repetition. Keep your expectations realistic. Remember that age equivalent. For success, rather than having behavior modification, consequences, etc., put support and scaffolding for success. Leave the room to fail very small. Put supports in. We call it external brain in the world of fetal alcohol. And that really means where there are holes in the neurobehavioral functioning, we plug them up with another human who's going to help with things like memory. Not, here's a calendar. Now, don't forget to use it, but I'm going to call you before your court appearance. I'm going to call you a day before and a half hour before, right? Direct help. Remember brain damage. When you are reacting with anger, frustration, disappointment, Oh boy, what a favor it is for you to remember brain damage. Think young in times of struggle. Occupational therapist is your friend. Anytime you can rope in some OT services, big help, because that helps the sensory, all the sensory stuff and all the over agitation stuff, that helps. And very important is to find and encourage the strengths and the joys. You want to support dopamine. You want to support that dopamine, that, you know, happy chemical. Otherwise, drugs and alcohol are going to look mighty good. They look mighty good anyway, because they help these guys feel normal. That is it. Thank you very much. I think we have 2 minutes left for anything that you might want to say.
We did have a question come through about, I think you might have touched on this earlier, but just in case not, how much exposure does a fetus need to have to develop
Oh,
the symptoms?
yes. No, I did not answer that one. The answer is less simple than we would want. I'm just trying to get back to you again. How do I see you here? I don't know if I can see you, but that's okay. Oh, there we go. Okay. But I don't get to see most people's faces. Anyway, stalling while I come up with my answer to that question, which is when you'll see in that section from the DSM that there is significant alcohol is defined as more than 13 drinks a month, more than 2 drinks per sitting. That is not to say that below that there is no damage done. Lots of people who did not drink much, a glass of wine or 2 at exactly the wrong time, have kids with issues. The face is only formed between the 19th and 23rd days of pregnancy, so that's really an artifact of timing. The brain damage happens the whole time. That's why we just don't focus on the face. Anything else? Any last minute? Anything else?
I think that is it. I think we've covered all the questions. If anyone has any last questions, go ahead and enter them in. We'll give everyone a second. Thank you everyone for joining us. In the meantime, I've put up the link for the survey. You'll also get directed there when the webinar ends. You can
That's
take
great.
that. And just as a reminder, the resources and handouts are currently on the CEBC website. I'll drop that link in here, and we'll be adding the additional resource document that Dr. Page is going to send us within the next day or so. You'll all get an email when the recording is available, and that'll be posted on the CEBC website as well.
That's great. Can I add, if I think that my contact information is on the first slide. So if anybody has anything left over that you want to talk about, get in touch with me.
Wonderful. Thank you very much.
Thanks. It was
All
a
right.
pleasure being with you.
Great. Thank you all. Thank you all for joining us, and have a great rest of your day.
Bye-bye.
Bye-bye.